Let's get more political reaction on the story. Joining us is DA Health spokesperson Michele Clarke and UDM leader Bantu Holomisa. A very good evening to you both. Appreciate your time on Inner Focus. General Holomisa, allow me to start off with you. Let's talk about how the National Council of Provinces proceeded with the National Insurance Health Bill and what has led to its adoption.
Well, of course, this process is culminated in today's approval by the NCOP after a thorough consultation and discussions, and the National Assembly, of course, approved it, and then it was referred to the NCOP. The next step now will be for the President, if he is satisfied, to sign the bill, but it doesn't mean that immediately we would be in a position to effect this bill, because we still have to have a budget for it. The Department of Health and National Treasury must tell us where will the money come from and so on. And secondly, the infrastructure in a number of hospitals needs to be improved. I'm from Eastern Cape. Almost 32 hospitals in that region are facing many challenges, let alone the availability of medical doctors. So I see this as a first step in a long process to effect this. And also, we must also not be blind to the fact that this bill is not only going to benefit South Africans only, but it will also affect those who are here from outside illegally and those who will be coming from neighboring countries just for health reasons. So we need to make sure that when we plan and budget, it's not only for the people who live within the borders of South Africa. Experience has taught us that people who come across from neighboring countries to get health services, and whether the private, we will have the personnel to handle those floods it's a debate for another day.
Michele, General Holomisa makes some interesting points, but before we go into those, let's get your reaction as the DA Health spokesperson. I'd imagine that you've thoroughly thought this through and obviously were advocating for a certain position. What is your reaction?
So the DA does not support the NHI Bill, and I think Member Holomisa highlighted some of those issues. The problem with the NHI Bill is that it promises what it can reasonably not deliver. Universal health care is a reasonable, lofty and ideal, and the DA really supports universal health care. But we support quality universal health care. And can the NHI deliver on this? No, it cannot. Currently, the public health service is under severe pressure. Hospitals and clinics are in a desperate state of disrepair, fraught with corruption, suffocating under increasing medico-legal claims, severely understaffed with regular medicine stockouts. I sent a question in February to the Minister, and he revealed that only 55% of public health facilities managed to comply to the ideal clinic status. Now, the ideal clinic regulations are within the NHI Bill, and these hospitals are expected, South Africa's hospitals and public health care is expected to comply to the specification of the ideal clinics. And since then, the status has dropped right down to 69.8% of hospitals that have submitted their assessments, but was found unsatisfactory. So that just gives you an idea of how bad the infrastructure is within our hospitals. And I can assure you, I visit hospitals throughout the country, and I know what I've seen personally because I'm on the ground. So, sure, for a while the private health sector might form part of the calculation of NHI as said in the bill, but for how long do we expect the private healthcare facilities and practices to stay afloat? And if we just look at the track record in terms of payments, etc., will our doctors be paid properly for their services? Will they be paid within 30 days? So that's a huge issue as well within the healthcare system. Never mind keeping the standard of care, keeping up to the standard of care. And we talk about medical aids which will have no purpose almost overnight. And what happens to all those employees that are suddenly unemployed? And let's not forget that instead of 80% of people depending on the public health system, you would now have 100% of people depending on the public health system, which would make the public health system completely overburdened, where you have 7.5 million people in South Africa who are on medical aids at the moment, and they will automatically be shifted over to a very burdened public health sector as it is already.
Now, General,
and of course, as Member Holomisa said, the cost. Who's going to fit the costs? They're talking about doing away with medical aid credits. They're talking about increasing taxes. They're talking about companies that subsidize their staff's medical aids to take those contributions towards the funding. There's no clear indication as to how this bill will be funded at this stage.
General Holomisa, you raised some issues there, and one of those issues was around how individuals from neighboring countries come into South Africa and access their health services here, and I'd imagine that the vast majority of them do not pay for this service. We're also a country that is burdened with hundreds of thousands of illegals in this country who have access to this facility. But I suppose the startling thing is that it's going to cost the fiscus something in the region of 250 billion rand to fund this. Where does the government get this money from?
Well, that's why I was saying it's going to take time for this bill to be implemented. You must also cater for the possibility that it might be taken for legal review. And the money, they will have to cut services elsewhere in order to fund this new policy. You must also remember that currently the Minister of Finance has publicly said there is no money. So where they will get the money from, I really don't know. But the chances are that they will want to appease the public. I mean, we are going towards elections. They might want to appease the voters currently in between. But I don't see it being implemented immediately. And then later on, they're going to be under pressure if they win election. They will be under pressure now to find money elsewhere. I wouldn't be surprised if they would go to UIF, PIC, and take that money and borrow it in order to effect their dream. So, unfortunately, the ingredient we are using to bake the cake of South Africa so that we can all share is not yielding any good results. We have been consumers from 1994 without baking the cake so that it can be bigger and satisfy everybody, and indeed the entire continent which has descended to South Africa. I don't know where they will get the money. Maybe you should have had the Minister of Health tell us here.
Michele, very quickly, please, if you will. We've got very little time to wrap up this conversation. Is this sheer politicking by the ANC government? Do you expect them to implement it without the money, or is it a case of ahead of next year's elections, the bill is adopted but does not see the light of day?
Well, I can assure you that in my view, this is politicking. It's a tool that they can go and sell to the voters for next year's election. And I can assure you there are going to be many litigations against this bill because in many ways it's unconstitutional. And the DA themselves are gearing up for litigation against this bill because of the issues around the bill and the powers that are simply given to the minister where there's absolutely no separation of powers. He's the judge and the jury around everything that's established within this bill. So I am 100% sure the ANC simply cannot afford to implement this bill, and their own finance minister has said that they do not have the funding for this. So, we'll watch and see where the funding will come from. But, I am not very positive around this bill and that it would actually take place. And over and above what I've just said is that our infrastructures, the ailing infrastructure, just cannot cope with for the needs of what's specified in this bill in terms of the ideal clinic specifications and regulations.
Michele Clarke, DA Health spokesperson and UDM leader General Bantu Holomisa, thank you so much for speaking to us this evening on In Focus.